So from the different types of shock that we have, which include what? Hypovolemic shock, neurogenic shock, septic shock, anaphylactic shock, and the rest of them. We've made video on them, and we've spoken about the treatments of each one of them, alright? And most of them, the treatment is you want to actually replace blood, okay? But basically, what are the principles behind this treatment? Or how will I say, what are the guidelines behind this principle? Guidelines behind the treatment, right? So it's not all about just cramming the drugs to use for these various conditions, all right? Um, it says a lot about you if you can explain yourself, right? As you are treating, what are you basically trying to treat? Okay, and that's what we'll be looking at in these guidelines for treating what shocks. All right. So in the guidelines for treating shock, it said that the cause or type of the shock should be identified. So you should know which type of shock you are dealing with. Is it circulatory shock? Is it obstructive shock? Is it neurogenic shock? Is it hypovolemic shock? And the rest of them. Then also blood pressure and plasma volume should be maintained with appropriate fluids and electrolytes. Okay, you know that in most shocks, the blood volume is reduced. Blood volume reduced, there's reduced what blood pressure, there's hypotension. So you want to maintain it, right? With fluids like whole blood or plasma. Do you understand? You want to actually also give some fluids that will replace electrolytes in the body too. So also the foot end of the patient bed should be elevated to increase venous return to the heart, and in return raise the blood pressure. All right. So now also, if the blood pressure is not increased sufficiently, the use of vasopressors like dopamine should be administered intravenously. All right. Then the fifth guideline now, in the case of hypovolemic shock, plasma expanders like dextrans should be helpful to maintain an adequate plasma volume. You know, in hypovolemic shock, the heart is intact, but you actually lost a lot of fluids from the body uh, you lost a lot of fluids from the body. So now um, the heart is receiving less. All right, so it is not being able to uh, give out more. Do you understand? So the input is low, the output will definitely be low. Then also you should correct acid base and electrolyte disequilibrium if it exists. Okay. Then adequate urine output should be maintained, as provide urine input and output chart to monitor the patient's urine production in 24 hours. Right. Basically try to check how the patient is urinating. They should consider what ventilatory support and oxygen administration if the clinical condition of the patient demands. Right? So these are basically the guidelines or principles for shock therapy or treatment. All right. So that's it, and bye.